Substance-related and addictive disorders represent a complex spectrum of conditions characterized by the continued use of substances or engaging in behaviors despite significant substance-related problems. These disorders fundamentally alter brain chemistry, particularly affecting the reward pathway, which explains why individuals continue substance use despite devastating consequences. The neurobiological basis involves neurotransmitters like dopamine, which create powerful reinforcement mechanisms that progressively override rational decision-making centers of the brain. The diagnostic criteria for substance use disorders have evolved significantly over recent decades, moving away from simplistic moral judgments toward evidence-based medical frameworks. Modern classification systems identify key features including impaired control, social impairment, risky use patterns, and pharmacological criteria such as tolerance and withdrawal. Importantly, severity exists on a continuum ranging from mild to severe, acknowledging the progressive nature of these conditions rather than viewing them as binary states. Substances commonly associated with addiction include alcohol, opioids, stimulants, cannabis, and nicotine, each with distinct physiological and psychological effects. Alcohol dependency remains among the most prevalent worldwide, with its depressant effects on the central nervous system creating both acute intoxication and potentially life-threatening withdrawal. Opioid addiction, meanwhile, has reached crisis levels in many regions, driven partly by prescription medication misuse before transitioning to illicit substances with higher potency and unpredictable composition. The development of addiction follows a predictable, yet highly individualized trajectory influenced by genetic vulnerability, environmental factors, and developmental timing of exposure. Research demonstrates that approximately 40 to 60% of addiction vulnerability stems from genetic factors, explaining patterns of familial transmission across generations. Environmental contributors include adverse childhood experiences, peer influence, socioeconomic factors, and availability of substances, creating a complex interplay of risk and protective elements that determine individual susceptibility. Treatment approaches have expanded dramatically, embracing a holistic perspective that addresses biological, psychological, and social dimensions. Evidence-based interventions include pharmacotherapy such as medication-assisted treatment for opioid and alcohol use disorders, cognitive behavioral therapies targeting maladaptive thought patterns, motivational enhancement approaches, and community reinforcement. The recovery process typically requires addressing both the physical dependence through managed withdrawal and the psychological dependence through ongoing support and skill development. Non-substance addictive disorders, including gambling disorder and recently recognized conditions like gaming disorder, share remarkable neurobiological similarities with substance addictions despite not involving chemical substances. These behavioral addictions demonstrate similar patterns of compulsive engagement, tolerance, withdrawal symptoms, and continued behavior despite negative consequences. Neuroimaging studies reveal activation of identical reward pathways, suggesting common underlying mechanisms despite their different manifestations. Special populations face unique challenges in both prevention and treatment contexts. Adolescents show particular vulnerability due to their developing brains, with early substance exposure significantly increasing lifetime risk for substance use disorders. Pregnant women with substance use disorders navigate complex medical and ethical considerations requiring specialized care approaches. Individuals with co-occurring mental health conditions, representing approximately 50% of those with substance use disorders, benefit from integrated treatment models addressing both conditions simultaneously. Prevention strategies operate across primary, secondary, and tertiary levels, ranging from broad educational initiatives to targeted interventions for high-risk populations and comprehensive rehabilitation programs. Public health approaches increasingly emphasize harm reduction frameworks, acknowledging that while abstinence remains ideal, pragmatic interventions can significantly reduce negative consequences even when complete cessation isn't immediately achievable. Evidence supports early intervention practices that identify problematic patterns before they progress to severe addiction. The societal impact of substance-related and addictive disorders extends far beyond individual suffering, creating ripple effects through families, communities, healthcare systems, and economic productivity. The financial burden encompasses direct healthcare costs, criminal justice involvement, workplace absenteeism, and lost productivity. Families often experience intergenerational trauma patterns, with children of parents with substance use disorders facing heightened vulnerability to both substance problems and related mental health conditions. Recent advances in addiction medicine include promising pharmacological innovations targeting specific neurotransmitter systems, personalized medicine approaches based on genetic profiles, and technology-assisted interventions providing support between traditional treatment sessions. The evolving understanding of addiction as a chronic brain disorder rather than a moral failing continues to reduce stigma, encouraging affected individuals to seek help earlier and communities to develop more compassionate, effective responses to these challenging but treatable conditions.